Hi everyone, my name is Dr. Kelly Guest and I am an emergency veterinarian here at Metropolitan Animal Specialty Hospital in Hollywood, and I'm going to be answering some questions today about puppy care and puppy maintenance. So typically puppies should be vaccinated at 8, 12, and 16 weeks of age. And all three sets of those vaccines should contain the core vaccines, something called DA2PP. So that stands for distemper, adenovirus, parvovirus, and parainfluenza. On the third and final set, your puppy will also get their rabies vaccine. There are other optional vaccines that I always recommend owners discussing with their primary veterinarian to determine if that's right for your pet. So it does depend on lifestyle, and it also depends on geographical location. So other non-core vaccines or optional vaccines include things like Lyme disease, Bordetella or the kennel cough vaccine, rattlesnake vaccine. So those are things that would be discussed with your vet depending on what's right for your puppy. So in general, you can bathe your puppy at home at any age, just obviously making sure you're using appropriate temperature water and making sure that you're keeping them warm after the fact, because they do have more of an issue with thermal regulating or keeping their temperature normal. Some places will allow you to bring your puppy to be bathed or groomed at a facility. So most of these places do require that they have their rabies vaccine. So that's going to be at about 4 months of age. Just keep in mind there are some places that do allow puppies without vaccines to go and be bathed. However, we just warn as veterinarians to be cautious about bringing your unvaccinated puppy around other dogs. Yes, absolutely. So puppies and kittens, just like babies, have a set of baby teeth, and they're called deciduous teeth. Those start to erupt or form at about 2 to 3 weeks of age, and those will fully be replaced by an adult set of teeth by about 6 to 7 months of age. So if you notice little teeth on the floor, or you're playing with your puppy and a tooth falls out, don't be worried. So there isn't going to be an answer that's going to fit all puppies because it depends on their breed, their age, their lifestyle, as well as their owner's schedule. In general, puppies should be fed a complete and balanced diet made for growth, preferably one from a pet food company that has feeding trials to support their diets, as well as those that are approved by what's called AAFCO, or the Association of American Feed Control Officials. In general, what you want to take into consideration is how many calories per day does my puppy need to sustain their growth. Don't worry, this isn't something that you have to figure out on your own. A lot of times it's laid out for you on the bag or can of food. In general, I do recommend trying to meal feed. So this means offering a set meal at a certain time per day. And the reason why this is good is because number one, it creates a schedule for your puppy, and number two, it allows you to really closely monitor how much they are eating. One thing I will say is that small breed dogs, so for example, Chihuahuas, Pomeranians, Yorkies, those guys typically should be fed more often. So if it's possible to feed them every 8 hours or 3 times a day, that is hopefully going to help prevent something called hypoglycemia or low blood sugar, which those small breed dogs are at risk of developing. Now you have to take into consideration that we should still be feeding the amount of calories recommended per day and just splitting it up into 3 meals instead of overfeeding them. Some puppies in general are grazers, so they're just going to nibble and pick at food throughout the day, and that might work for your puppy. However, do recommend following up with your vet every few weeks for checkups, just to make sure that we're weighing them, making sure they're gaining the appropriate amount of weight, and also for your vet to assess what's called their body condition score to make sure that they're growing appropriately. The final thing with kind of diet in puppies is that a lot of us use treats for training and things like that, which is perfectly fine, just making sure that that's only 10% of their daily intake. So again, this might be a question that depends on what type of dog you have. In general, most veterinarians will recommend that small and medium breed dogs be spayed or neutered by about 6 months of age. And this is particularly important for female dogs, and we want to spay them before their first heat cycle. In large and giant breed dogs, the recommendation is actually a little bit different. Because of how their growth plates close, we actually want to wait a little bit longer to spay or neuter them. So the recommendation is usually waiting until about 1 to 2 years of age. So signs that we consider to be concerning in a young puppy are anything involving the gastrointestinal system, so things like vomiting, diarrhea, decreased appetite or no appetite at all. We also get concerned about anything related to respiratory. So if you see any sneezing, coughing, ocular or nasal discharge, any change in their respiratory rate or effort, those would all be reasons we want your puppy checked out. There are other things that are concerning but potentially could wait to see your primary vet, so things like anything involving the skin, so fleas, rashes, itchiness, hair loss. Finally, if your puppy unfortunately does get into something that they're not supposed to, so if they're exposed to any potential toxins, things like chocolate, grapes, human medications, those would all be reasons we'd want you to have your pet checked out right away. And you could even call the ASPCA poison control line to see whether or not you need to bring your pet in right away. Finally, if there's anything that's out of the ordinary as far as their behavior or their mentation, if they're super lethargic, you notice anything like seizure activity, those would be things that we'd want addressed right away.